Welcome to Mental Healthy, the podcast where we share stories of the professionals and experts worldwide working in the mental health field. Here's your host, Dr. Jeanneane Knapp.
Well, welcome everyone to the Mental Healthy Podcast. I'm glad to have you with us here today. I've got a good friend of mine here in the program today, Jeanneane Maxon, and we've known each other for at least 10 years. But obviously the listeners don't know you, or probably some of them don't know you. So could you share a little bit about yourself and your background?
Absolutely, Kenyon. Thank you so much for having me on. So I'm in my 20th year of practicing law. Don't hate me for that. I'm licensed in New Hampshire, but not licensed in the other states. The vast bulk of my time in practicing law, I've specialized in helping out nonprofit pro-life organizations, such as crisis pregnancy centers, some pro-life policy organizations. I started off doing commercial litigation in New Hampshire and quickly decided that was not what God wanted me to do, and became the general counsel of CareNet, which is a national affiliation organization for pregnancy help centers. They are located just outside of DC. Was there for a full 5 years, and then I transitioned to become the vice president of external affairs and corporate counsel for an organization called Americans United for Life, which at that time was located in DC. I was there for 3 years, and then I was unexpectedly diagnosed with glioblastoma multiforme, which is a terminal form of brain cancer. But praise the Lord, almost 10 years later, I'm still here. And so after I went through the chemo and all that nasty stuff that you have to do to fight a disease like that, I gradually transitioned into a consulting practice. I currently serve as an associate scholar for the Charlotte Lozier Institute. I write a quarterly column for the American Association of Christian Counselors. And I also serve as an ambassador for a device I wear on my head that is a treatment for brain cancer. I live in the Dallas, Texas area, and I do all my work from home. And I just continue to support, people, mental health professionals, and people like pregnancy centers through the work that they do in this area.
That is great. Well, I totally respect the work you do with the pro-life movement. Here where I work at Liberty University, we're a very pro-life institution. And I know this past year, we were at the March for Life there in Washington, D.C. and brought up about 1,000 students with us, which was great.
It's wonderful.
And I remember being at the March for Life like 30 something years ago. And it's great. I don't make it every year, but a lot of them. So, and I know there's people behind the scenes like you who make it all happen. So thank you for doing that.
That was a huge thing when I was working up in DC.
Yeah, that's great.
It's a big day. Mm-hmm.
Well, and I told you earlier, a lot of our listeners are graduate students and mental health professionals across the country. And a lot of them, deal with, clientele who go through difficult situations with either being post-abortion or considering that, or crisis pregnancy and all that. And you've got a lot of expertise in this area, but could you elaborate a little bit more? What is your expertise in the area of crisis pregnancy counseling?
Thank you so much, Kenyon, for that question. I actually grew up in a pregnancy center in a weird way. When I was 7 years old, my mother became the executive director of a network of pregnancy centers in the Amarillo, Texas area. And so she did that from the time I was 7 till I was 18. And I think anyone whose parents have been that involved in a pregnancy center will tell you it becomes a family affair. So growing up, like, my chores weren't washing dishes, they weren't vacuuming. It was go to the pregnancy center and help your mom label bulk mail or help your mom make copies. But, I looked back, like, hindsight is 20/20, because when God called me into working for CareNet, suddenly I realized that my legal background combined with what I already knew about pregnancy centers, having grown up there, was a perfect combination to make me serve them well. So, but I'm glad you mentioned that your listeners are mental health professionals and students, and that you mentioned that a lot of them deal in this area, because one thing that I've also worked on is I've taught this topic at the World Conference and National Conference with the American Association of Christian Counselors, which is how we met, Kenyon, as you know, many years. And every time I've taught it, I always ask the audience, how many of you have dealt with this issue in your own practice? And 90 to 95% of them every time raise their hand. So if you have not dealt with this issue, or if you do deal with this issue and you just need a little, you know, update, this is a good podcast for you to be listening to. If you haven't dealt with this issue before, if you're a student, you will encounter it at some point in your practice, more than likely. One little thing I do want to say, I'm going to talk a lot about the law and talk about some medical risks, both physical and mental. And I just need everyone to know I'm not a medical health professional. I'm only licensed in New Hampshire. So although I've studied a lot and know a lot about this, really take it as educational. And if you encounter a problem within your own practice, you need to reach out to an attorney, to your supervisor, to somebody else who can help you.
Well, that's great. I appreciate you mentioning that's a really ethical way to approach it all and talk about scope of practice and things like that. That's great. You know, when I think about this whole issue of pro-life issue and abortion stuff and all that, in the last few years, the Supreme Court overturned Roe versus Wade and all that. But I think a lot of people out there are just sort of overwhelmed by all this. And it's like, what does this all mean? And somebody on TV said this and the other person said the opposite. And you being a lawyer in this topic, and not just a lawyer, but a national leader lawyer, could you tell the listeners a little bit about what are some of the changes that have occurred in abortion policy since they overturned Roe versus Wade?
Yeah, it is so confusing, as you mentioned, Kenyon, but just, you know, kind of as sometimes I cheat and use other people's research. So a really good website to go to if you want an update on your law is just Google FRC pro-life maps. And you'll get a map of all 50 states. You can actually click on your state and see what your specific law is. But generally, there are 29 states in the United States, so that's a majority, that protect life at some points during the pregnancy. That can be as soon as conception and as up to 22 weeks, which is kind of late in the pregnancy. That would be Kansas, by the way. I was a little disappointed in them. Anyway, of those 29, 22 protect it in the early stages. So that would be either at conception or at when the heartbeat is detected, which is typically around 6 weeks. Now, some of those laws are in litigation. So if you go to that map and you see that, oh, it's not actually in place, it's currently in litigation. But, you know, we're really hopeful that once litigation is sorted out, that those will be put into place just like the others. So anyway, there are good numbers of states that have pro-life protections in place at early on in pregnancy. And so both the pro-abortion and pro-life movement have different responses to that.
Yeah. Well, you and I are familiar with these organizations a little bit since we've been in the same circles for a while. But for you listeners out there who go, what are all these acronyms? Like, what is FRC?
Yes, that's the Family Research Council.
Yeah, Family Research Council. They're a great pro-life and pro-family organization there in Washington, D.C. So that's great. That's a good update. Well, let me ask you this, too. How is the pro-life movement responding to abortion following the reversal of Roe versus Wade?
Well, I think like the biggest thing I've noticed is even the policy organizations are kind of, recognizing the need to really help out women facing these decisions. So a lot of them are developing, and you'll probably see this a lot if you follow this, what we like to term the pro-life safety net. So there's groups like herplan.org, which is administered by Susan B. Anthony, Pro-Life America, which, by way of disclaiming, that is one of my clients. And so they're developing a network in a number of states where a woman could get on and could get online and find help in her area. And I think also on the state level, a lot of state representatives are wanting to help out the situation as well. So there have been a number of states, I don't remember the exact number off the top of my head, that have initiated new programs that fund pregnancy help organizations, which could be pregnancy centers, adoption agencies, maternity homes, and even some pro-life social service organizations such as Catholic Charities or Lutheran Social Services, which has been great. There's also a number of states that have instituted tax credits for individuals that give donations to organizations like that. And all that information can be found online at the Charlotte Lozier Institute. That's another one of my clients. It's lozier.org is the website.
How do you spell Lozier? Just to make sure people get it right.
Lozier.
Okay, great.
Yeah.
Good. Well, I know when you and I have talked in the past as well, when laws change, it's not just the pro-life movement that adjusts,
Right.
it's the abortion industry, the abortion mills. Um, how has the abortion industry responded since the overturning of Roe v. Wade?
Great question, Kenyon. Polar opposite. Instead of wanting to build a safety net, they have described what they're doing as a big spider web, which out of the words, their own mouth, like just think of the difference. Like a safety net is designed to catch a woman when she falls and protect her from destruction. Spider webs are designed to catch people and devour them. So that actually term spider web was from one of the Planned Parenthood's representatives. And Planned Parenthood, I'm sure most people know, is the nation's largest abortion provider. So I'm just going to focus on them as one example. So their latest annual report for their fiscal year 2022 through 2023 recently came out, and they really hyped on this idea of developing this spider web throughout the country. They have hired 90 what they call patient navigators, whose sole purpose is to help women in states that do protect life obtain abortions out of state. So 90 of these are in place across the country. They brag in there. I mean, if you look at their previous annual reports, they always kind of downplayed their abortion. There's a whole kind of time frame where they wanted to say, no, abortions don't make up a significant portion of our revenue. It's only 3% of our, which was a false way of portraying their statistics. Now they're openly bragging about it, which is just really concerning. So they did brag about the fact that they helped 33,000 women travel with travel expenses for abortion. 15,000 of these women actually had to left the state, and they assisted them in doing that. And then they actually paid for 50,000 abortions themselves. They subsidized those fully. So, and they have launched something called abortionfinder.org. And when you go on that, it is a website designed to, show women in states like here in Texas, where I live, life is protected at conception. So it's designed to really show women how they can still get abortion. And the overall idea is that abortion is still available in all 50 states, and that's either through the abortion drug or through the assistance that they will provide you of going out of state to obtain an abortion. So I went on and played with that website a little bit. First, I just pretended that I was 7 weeks pregnant, and a whole network of referrals to facilities in Kansas, where, as I said, abortion is legal up till 22 weeks, as well as like a list of referrals on how to get the abortion pill via mail, which is just frightening. I mean, you would still have to have a telehealth meeting with the doctor, but like no in-person meeting, no regulation. Most states still allow, all 50 states, you can still get the abortion pill in the mail. So that's kind of that's what they're doing, as opposed to the pro-life movement really trying to help women make the healthy choice for life or for adoption, if that's what they would prefer. And, supporting them financially and with referrals to mental health and referrals to good prenatal care throughout the country. So it's really an amazing juxtaposition on the responses that you're seeing after the Dobbs decision.
Absolutely. Well, I know you've worked with this a lot on the legal side of things and all that, and that's your expertise. But I know you've been around long enough to see the mental health effects on some of the women that go through abortions. Since my audience too, by the way, is largely mental health professionals,
Yes.
Could you speak to that a little bit? Like, what are some of the mental health concerns that are associated with abortion?
Numerous. There is again, I'm going to drop another resource summary that cites several studies for those of your mental health professionals that's important too. It's called A Summary of Known Health Risks of Abortion, and that is published by Americans United for Life. Again, it's available online just by Googling that. And it's very comprehensive. It discusses both the physical and the mental health. But I pulled some of the data from that sheet for mental health. And one of the things that I think actually many of the people that were our listeners that have worked with this can probably attest to the accuracy of these. That following an abortion, 34% of American women studied had thoughts of suicide. There's also a significant increase in depression, anxiety, post-traumatic stress, and substance abuse disorders. And interestingly, for women who are under age 25, we're certainly at a higher risk for developing these, which is interesting too, because that's the age where most women will get an abortion. they're at a 40% increase of that compared to people in other age ranges.
Wow.
Mm-hmm.
34% higher suicide, depression, substance abuse. Goodness. Yeah. I've heard of post-abortion syndrome in the past as well, that there's all those summary of characteristics that fit many women who have
Yes.
abortions.
And
So,
a lot of them don't seek help because there's something called disenfranchised grief, which I think may be a term that your listeners may be familiar with. And there's a good article that I present on AACC every year that discusses that. It actually came out from the American Counseling Association, if you can believe that. So anyway, that's a good one. It's just a good term to remember, because you may take some coax. You may have to kind of coax your client to discuss more about it, because many women don't feel like, because it's been legal and because so many women do get abortions, that they should be grieving, or that they're not informed before an abortion that this is a possibility. So unless they go to a pregnancy center that has these studies, or go to a pro-life mental health professional that can educate them on this when they're making the decision, they're quite likely to think that they don't have a right to grieve.
yeah. So the normal reaction of losing your baby,
Yes,
they're not allowed to grieve it. I guess
Mhm.
it with a lot of pro-abortion groups,
Right.
that makes a lot of sense. And then I would assume too that a lot of women that go through an abortion might, well, of course, most of them probably do realize how sensitive and controversial the whole topic is in society. So a lot of them probably don't want to come out and talk about it too openly. So if you
Right.
stuff it because you're not sure how it's going to go, then you just don't really deal with it either, I guess.
Absolutely. Mm-hmm.
Yeah, goodness. Well, this is all really interesting, but we're going to pause here for just a second and hear from our sponsors, and we'll be right back. Hey everyone, you need to check out Empower Counseling PC. It's a Forest, Virginia-based counseling agency that serves clients in all areas of mental health with in-person therapy sessions or telehealth within the state of Virginia. With 27 counselors, a psychiatric nurse practitioner, and an eating disorder registered dietitian, their mission is to treat the whole person. They specialize in eating disorders, postpartum, play therapy, PTSD, substance abuse, infertility, grief, marital issues, and so much more. Please visit them at www.empowercounseling.info to learn more about them and their compassionate team. Well, welcome back, everyone. I appreciate you listening. And we're going to continue this conversation with Jeanneane Maxon here about abortion and all the effects of it on people. Just a minute ago, we talked about, some of the mental health concerns. Well, let me ask you a little bit more about that. Are there other concerns that mental health professionals should be aware of with people who are going through this?
Absolutely, Kenyon. I meant one that has been uncovered and discussed a lot within my circles, although maybe not so much publicly, is the fact that what is choice? When the pro-choice movement says we want women to have choices, like what does that actually mean? Frederica Matthews Green, who is an author and a pro-life convert, once said, a woman wants an abortion like she wants an ice cream cone or a Porsche, as an animal caught, not like she wants an ice cream cone and a Porsche, but as an animal caught in a trap trying to gnaw off its own leg, meaning that she's in a position where she feels like she doesn't have a choice. She's willing to hurt herself to get out of her circumstances, which just going back to the pro-life safety net, which is why that's so important. So the question is choice. And there is a recent study, again, it's on the Lozier Institute website. It's found that nearly 70% of abortions are either coerced, unwanted, or inconsistent with a woman's preferences and choice. So 70% of women who had an abortion stated that it was against their own values and wasn't really their preference or what they wanted. 1 in every 4 said that they were coerced into it. So that is a more kind of common thing that's happened. And that abortion coercion's been a problem since since even before abortion was legalized through Roe. But it's becoming more concerning with sex trafficking and all the other issues we're seeing. And just then, and also, partners, boyfriends, even husbands or parents or people are like, no, you cannot have this baby, even if you want it. You really have to have an abortion. And I think a lot of women, unfortunately, feel powerless to stand up for themselves against that. So again, that's just another thing to keep in mind is I do think, as Christian counselors, we don't just want to avoid maleficence. We want to approach it with the approach of beneficence to do the best for our client. So it's just good to know, to assure her that she does have a choice, that there are organizations and people that will support her if she does choose to either parent or place the baby for adoption.
Yeah, that makes a lot of sense. And that's interesting, that percentage that 70% really don't want to get the abortion, but they do for various reasons. They're coerced or things like that. A lot of the listeners here are familiar with the topic of moral injury, and that, like, when you're put in a situation where you act against your belief systems or things like that, it's not just the psychological effects or physical effects that it could cause, but there's that moral injury aspect too. And that reminds me too, I'm getting a little bit of a rabbit trail here, but I was talking to someone not too long ago where it was actually the man who was with the girlfriend at the time. They got pregnant, and then he really wanted to have the child and all, and she was like, no, it's not going to fit with my life or whatever. And she went and got the abortion, very much against the will of the father of the child. And now he's walking around with a lot of moral injury and a lot of regret and everything, that he had no choice. I mean, yes, he was the father, but she was the one that was impregnated, and she was the one that carried the child. And all of the choice to kill the baby was given to her, not him.
Right. And thank you for bringing that up, Kenyon. That is a big problem. And I think, unfortunately, even I'm guilty of this, but a lot of the pro-life movement tends to focus on or anyone involved in the abortion issue tends to focus solely on the woman. And unfortunately, in our society, men do not have any rights when it comes to protecting their unborn children. I don't think like there's any law that's permitted for them to even give permission. I know that for a fact. I don't think there's a law that requires a woman to even notify them. So yeah, be prepared for men suffering from this too. But I do want to just add to this that when women do get the support they need, they tend to choose life. So if a man is in that position, I think, or you have a client who's male in that position, just encourage him to really have, and it may not make a difference, but a lot of times, like if a woman goes to a pregnancy center and sees an ultrasound of her baby, she'll connect with it and that'll make a difference. And that same study showed that 60% of women said that they would have preferred to give birth if they either had more emotional support or more financial security. And one story of just one woman, but it's just such a great example, is there was an article years ago about a young woman named Caitlin Bruce, who was in her second pregnancy. She already had a 2-year-old, and she had been impregnated by a partner that was significantly older than her. She didn't have a job. So it's like all these factors that, you think, but she really wanted to keep the baby. She was really conflicted. And when she got on the abortionist table in the middle of the abortion, after seeing an ultrasound, she said, stop. But she claimed that they forcibly held her down and aborted her baby against her will. She filed a lawsuit after she had contemplated suicide, and she ended up not going through with it because her mother called her like it was a total miracle. But what she said is, I was really confused, asking everybody what I should do. Everybody told me, you're too young. She said, but what I really wanted to hear was, we will help you out. What an amazing quote.
Absolutely. Absolutely. Well, let me go back to something you mentioned a little bit earlier. You mentioned earlier that abortion is still available to women in all 50 states. But I know, and you also said it, the law varies state by state and all that. It's sort of confusing, like you said, to a lot of people, since the laws are all different. Could you elaborate a little bit on that, about, how it's available in all 50 states and what that really means?
Absolutely. So another response that the pro-abortion industry has had to the court's decision to reverse Roe is to really promote the abortion pill as an option. And that is still available in all 50 states. And that's, if you go to the Abortion Finder website, or even if you just Google it, it's really easy to just order the abortion pill is a combination of misoprostol and mesoprexol. So the combination of these two drugs, they take the first one and it causes the baby to disconnect from the uterine wall. And the second one they take later, and it actually induces labor so that the woman has a baby at home alone. And that's very emotionally traumatic in and of itself. But because of that, any woman, like even though I'm in Texas and, abortion is, life is protected at conception, I can go on, I can get a telehealth visit through abortionfinder.com, or I can even Google, purchase the abortion pill, and I'll find a way to do that. And it will be mailed to my house pretty quickly, like within a week usually. And then it will have instructions, and I just abort at home without an in-person medical consult or without any instructions as to what to do if there's an emergency, if there's any complication. So that's why it's still available in all 50 states.
Wow. I know there's a lot of blood and other medical complications, and I'm not a medical doctor, so I better not say too much. But let me ask you this: you're familiar with this? How do the risks of abortion drugs like that abortion pill compare to those of being in a in-clinic abortion clinic?
So doctors have come out and said that they're 4 times the complications of an in-clinic abortion or surgical abortion. And by the way, these now make up 63% of all abortions in the United States. So it's more common that you'll have a client considering taking an abortion drug or who has taken an abortion drug and is now suffering from complications.
Wow, goodness. I've heard a little bit of a rabbit trail here. I've heard from some people that, future infertility issues are one of the side effects, and infections, just a lot of different things. Are you aware of some of the side effects or the complications that could come from this?
Yes, infections for sure. When they take the drug, it lowers their immunity. So even fighting off normal things, like there is some weird, and I don't remember the name, but some weird thing that we're all exposed to in the soil all the time, and that if you don't have your immunity built up, it can cause an infection and very quickly lead to a loss of life. There was a young woman, Holly was her first name, I forgot her last name, that actually lost her life due to this. But I do want to kind of also discuss some of the mental implications, and the studies on these, as you would expect, are not quite as thorough as what they know physically. But I did find, I watched a video, which I'll give the information for that later, which, talked about 2 stories from 2 women. And I pulled some quotes from these that they talk about their experience using the abortion drug. And I pulled some quotes that I think the first woman is Tammy, and I'm just going to read this. When I met with the doctor, they told me that the abortion pill was going to be a simple, mostly painless, private, and safe process. Then in describing what happened after she expelled the baby in a toilet, she said, horrified, I looked down and there was a baby in the toilet. She described her feelings as devastated. This was a formed, recognizable, undeniable baby. My baby. I was angry. I was ashamed. I was very hard to be around. When in talking to her about herself, she said, how does she grieve openly? So again, there's that disenfranchised grief. The second story is from Elizabeth. So she stated that she was conflicted, and in the abortion facility, the staff basically coerced her into taking the abortion pill. No one counseled me, she said. The doctor promised me I would feel relieved. She said, but I didn't feel relieved. In describing the abortion pill process, she said, I miscarried the child whole. I held him, and she's in tears as she's saying this. These are very hard videos to watch. I felt overwhelming guilt and sickness inside that I could not process. Nightmares began. I stopped eating and became anorexic. I was later diagnosed with post-traumatic stress disorder. So I think in some ways people would argue that the abortion pill, because it's done at home, because you have to dispose of the baby, either by flushing it down the toilet or by however else you would dispose of it. And it's pretty much alone because nobody wants to go through that with someone else watching them. It's really, really hard. And I think yes. So in the case of Elizabeth, of course, she had severe nightmares, post-traumatic stress disorder. And in the case of Tammy, didn't know how to grieve about it. Felt again like she had to hide it and couldn't tell anyone about her experience.
Goodness. Well, I'm definitely hearing some more overlap here with mental health issues. I mean, you mentioned, PTSD and nightmares and all that. Considering that we're speaking to a mental health audience of counselors and psychologists and people like that, and largely Christian ones, what can mental health professionals do in light of this situation?
So I've identified three things. I mean, one thing is, of course, just educate yourself on this. There's a whole lot of information out there that I haven't been able to discuss in this interview. But you can go to the Lozier website. And I want to correct what I said previously, Kenyon. It's Lozier Institute. I'm going to pull it. It's Lozier Institute is spelled OIOLOZIER Institute. This is all one word. INSTITUTE.org. And when you go to that website, there's going to be a tab called Initiatives. And if you go down to Abortion Drug Facts, that has the video I talked about, which I do recommend your listeners take some time to watch. It's not enormously long. It's a video done by Life Issues Institute, and it has those interviews. And it's really just very compelling. But there are other videos too that kind of go into interviews with doctors. And there's a lot of information, the statistics, and again, like state information. So all that can be very helpful. So educating yourself, and then be prepared to help both women and men, I should say, that are dealing with this issue. And also just, there's really two aspects of it: is pre-deciding what to do, and post helping out after they've made that decision. In the pre, I do think it's appropriate and maybe very much recommended for especially Christian mental health professionals that are looking at this from an angle of beneficence rather, to share with the woman, what the mental and physical consequences of, abortion, and especially the abortion drugs, since it's so popular now, are, because you want to help her avoid those, and to also just direct her to resources that can help her. The Her Plan website, herplan.org, is really good because it provides like everything from material assistance help to financial help. But also your local pregnancy center can be very helpful. Some churches have programs, so you might need to research that a little bit. But yeah, definitely helping out women in that way. And then finally, to be available yourself to offer help. So I say to churches too, because 70% of women who've had an abortion identify themselves as a Christian. And you can imagine the disenfranchised grief that they're suffering with that. So it's like, I can't be open about it. I'm a Christian. I'm not supposed to do that. So definitely just, if you have a church, and just mentioning to your pastor or whoever would be the appropriate person, I'm willing to help out. Even if you can't do it totally for free, if you could do it at a discounted rate or whatever you could do to help out a woman in that situation. But also, I will tell you that pregnancy help centers really love when they have a mental health professional that they can refer to. So just, opening yourself up to them as a referral, again, even at a discount rate, or if you're willing to even do it for free, just out of the goodness of your heart, that would be wonderful.
That's great. Well, you've just been a fountain of information during this whole interview, and you mentioned lots of websites like FRC Pro-Life Maps. You mentioned lozierinstitute.org, herplan.org. Are there some other places that you would recommend people to go to get more information, books or websites or videos?
Yes. If it is a medical situation, the APLOG, the American Association of Pro-Life Obstetricians and Gynecologists, work in this area quite a bit. And then I do think probably the best one is that lozierinstitute.org, and going under Abortion Drug Facts. Again, you have to hit the tab that says Initiatives. Is really helpful. It goes through all that. But be careful when you're it might be fascinating for people if you do want to kind of go to Abortion Finder just to play around with it yourself and just see what they're doing to manipulate women. I think that's interesting too. But of course, I wouldn't refer a woman to that one. But yeah, and then just, being knowledgeable about where the pregnancy centers are in your area, which you can get that information by going to optionline.org, spelled like it sounds. Optionline.org is a great place to get resources.
Wow. Well, this is great. So many different websites, so many different pieces of information. And I'll tell you, but before we wrap it up, I want to be, respectful of your time and the listeners as well. I want to say thank you first off for all your work with the pro-life organization. I know it's a real hot button issue in our society, and there's a lot of conflict and nastiness around it. People attacking you and saying unkind things and stuff like that. So thanks for being a backbone and standing up for the pro-life babies and standing up for God, all the people made in the image of God who are being killed by this. But before we wrap up, though, I always try to let listeners end with, hearing some final thoughts or maybe something else God might have put on your heart that you wanted to share with people today before we wrap it up. So is there anything else you can think of that you just want to share with everyone?
There is. I just want to emphasize, because I know your listeners are mostly Christian, God's heart for women in these situations. And I did some just offhanded research. The earliest case of what I would say a crisis pregnancy, if we want to use that term, is actually in the Bible, and it's 4,000 years ago. It's the story of Hagar, who, as many of you will remember, it was the story of Abraham and Sarah. When Sarah could not get pregnant, she said, "Oh, Abraham, sleep with my maidservant Hagar," who was estimated to be around like a young teenager, maybe 14 years old. She wasn't a member of God's chosen race. She was Egyptian. And anyway, so I think most of us know the story. Abraham slept with Hagar. Hagar conceived. And then Sarah started to mistreat Hagar. So Hagar's response was, and what's amazing to me about this story is that so many women today respond just like Hagar did 4,000 years ago. She runs away from the camp. So she's away from her shelter, away from food. And she finds a spring in the desert. She falls down, and the angel of the Lord actually, so God sends the angel of the Lord to her. He says, "Hagar, where are you going and where have you come from?" And she's honest. "I'm running away from my mistress, Sarah." And he said, "Go back to your camp. I will so increase your descendants that they will be too numerous to count." And so her response that she gives God is just so beautiful. She said, "You are the God who sees me." And I love that, because I think so many women today feel like they're not seen. And that's what Hagar was feeling. But then she does go back. And the other cool thing about that one is that she actually reveals to Hagar, "You will have a son, and you will name him Ishmael." So God recognized the humanity of her unborn child and actually gave her unborn child a name. I just think that's so beautiful. So when you do this work, and as you're right, Kenyon, there can be times where it's hard just from, walking through this with your clients, and even nasty things that people will say. Just remember God's heart, and you're the reflection of God's heart to them, because you are the ones that God's using to reach them.
Absolutely. That's a good word. You are the God who sees me. That's a good scripture right there. And I hope the listeners out there, hearing Jeanneane today talk about all this will remember that when they talk to your clients, that God sees them, God cares about them. Even if they're post-abortion and they've already killed the baby, God loves them and wants to redeem them and give them hope in a future. And so thank you so much for being on here today, Jeanneane. It's a pleasure to see you again, and just see the way God's used you over the years to help so many pro-life organizations.
Thank you, Kenyon, and thank you to all your listeners who gave me the time today to educate them on this topic. I do hope it'll be helpful and fruitful as they move forward in their different practices.
I hope so. That's my prayer as well. So thank you so much for joining us, Jeanneane, and Jeanneane Maxon, one of my pro-life heroes. And listeners, thank you for joining us as well. We appreciate you joining us here in the Mental Healthy Podcast, and we'll look forward to having you with us next time. So thanks so much. Bye-bye.
Thanks for listening to this episode of Mental Healthy. If you want to hear more episodes, please hit the subscribe button wherever you get your podcasts, and head to linktree.com/mentalhealthypodcast for all of our social media platforms with the latest mental healthy content. If you have a story to share that relates to what we discussed in this episode or any other episode, please contact us at mentalhealthy2020@gmail.com. That's mentalhealthy2020@gmail.com. Thank you, and God bless.